Heart failure patients do not usually worsen overnight. It often starts with small signs at home, signs that can often be overlooked by patients. And today's episode, we're bridging that gap. Post discharge care and signs to recognize before it leads to another hospital visit. Our guest is a registered nurse who has spent over 15 years as a heart failure nurse coordinator and has helped countless of patients navigate the transition from hospital discharge to long term care. Please join me in welcoming Miss Jessica Lamar. Welcome to Myths to Medicine, Jessica.
Thank you so much for having me. I'll tell you just a little bit about myself to get started. So, I am a heart failure coordinator nurse. That is my passion. And I've been a nurse for a little over 16 years now. Almost all of that has been in the hospital setting with heart failure patients. And I'm a board certified cardiovascular nurse and a certified heart failure.
Thank you so much for that introduction. So, you've worked as a heart failure nurse coordinator for 15 years. And when we talk about or when we listen the term heart failure, we often think the worst. Most people think it's something that cannot be managed at home. What are the biggest myths that you've heard when it comes to heart failure management at home?
So, hearing that you have heart failure can be very scary. It can be life changing. But I think the important thing for patients and their families to remember is it is a chronic progressive disease. So, that means when you have heart failure, you have heart failure. It's not something that's going to go away or that we're going to stop following. But in that same breath, it is something that we can hopefully manage at home for a very long. So, heart failure does not mean that your heart is failing and it's going to stop and that's the end of life as you know it. It does mean, though, that you really need to be able to recognize the signs of heart failure, be able to track different things like your weight, your blood pressure, your heart rate, and be able to translate those into, is this an exacerbation for me? Is it a good day? Is it a bad day? And those are the things that really make you be able to stay at home and live with heart failure for a long time.
There are so many signs and symptoms that can be missed. So, what are the early warning signs and symptoms that families most likely miss when it comes to heart failure management at home?
So I think most people with heart failure and their families, once heart failure gets to a certain point, they can recognize it pretty easily. So the things that usually bring people into the emergency room is a very large weight gain, swelling or edema in the lower extremities. We see that a lot, and shortness of breath. So those are the three things I would say that people know are signs of heart failure and that they need to get help. Some of the things that I feel like go unnoticed until they're really, really bad. So think about a patient that typically, if you can lay flat at night to sleep and all of a sudden you need an extra pillow, that might be heart failure. You may be getting some extra fluid in your chest that's causing it to be harder to breathe at night. Another thing that patients often will mistake for various things, if your pants feel a little tighter, like around your waist, sometimes that's a very subtle sign of the fluid gain as well. So I think the biggest thing is weights, daily weights. Monitor how much fluid you have on board and thinking about how short a breath you get with usual activities that you wouldn't have a problem.
Thank you. That's incredibly helpful for our listeners. And honestly, recognizing them can be a game changer. So, what does heart failure management at home actually look like, beyond the textbooks?
So, in nursing school, they teach us, all of these, 3,000 symptoms that could be heart failure. It could be something else too, though. But I think for patients and their families at home, things like weighing yourself every day. If you gain more than 3 pounds in a day or 5 pounds in a week, unless you're on a cruise or your wife made, Thanksgiving dinner, it's probably fluid. So a rapid weight gain like that is definitely cause for concern. So those things alone, I would definitely reach out to your heart failure coordinator or your cardiology office, let them know. A lot of times, if we catch these things early, we can even do things like give you IV medications in the office to keep you out of the hospital. So being able to pinpoint um, signs and symptoms very early, even if you're starting to have an exacerbation, we can still keep you out of the hospital. So we talked about the daily weights at home. Other things such as recognizing the salt content in foods that you eat. So salt attracts water, and if you have a lot of sodium in your diet, it's going to make you retain more fluid. Even patients like my dad, for instance, he doesn't have heart failure, but if he eats a hot dog and French fries, his wedding ring may not fit because he's going to swell a little bit. Well, if your heart's not working properly, it's that times 20. So, really being aware of the sodium content in your food, especially canned foods or processed foods that you get at the grocery store, those typically contain a much higher sodium content. So, don't be afraid to look at those labels, when you're buying things at the store.
So it is a combination of daily food that you eat and also tracking
Mhm.
the symptoms that mentioned by the doctor. So from your experience, what has separated patients who do well at home from those who end up back in the hospital?
Just encourage patients to be very curious, ask questions, be involved in your care. The more that you understand why you take your medicines or why we're asking you to do what we're asking you to do, all of those things kind of start to click and you're connecting the dots about how heart failure works, what I can do, what I can't do. I really encourage patients to do everything you can to understand the disease process and to understand the treatment plan that we have with heart failure. There are guidelines that we try to get every patient on, but it very much can be individually tailored to the patient. How much medicine you can tolerate, how far along your heart function is. It can be very difficult, I guess, to get a patient on exactly what we need them on if they're not interacting with us, if they can't tell us they're tracking their weight, or if they can't tell us they're limiting sodium or fluids and things. So I just really encourage you, be involved, ask questions, and try your best to do what your doctor tells you to do. And those are the things that'll really help keep you out of the hospital. And having a really strong family support, even if it's friends, it doesn't have to be your blood relatives, it could be the family you create for yourself, but having them involved so that you feel supported, that's huge too.
So it comes down to communication, adhering to your doctor's guidelines, and family support, of course. That's very simple and very effective tips. So, what is one symptoms patients usually ignore that has led to hospitalization?
So sometimes I think about patients in the summer. A lot of times, there's certain times of year that we see more patients with heart failure in the hospital. Usually around holidays, and that's with increased sodium, intake at Thanksgiving and Christmas. You get that ham or stuffing, and a lot of times, that's enough to put you over the edge as far as sodium intake, and it really increases that fluid. So there's small things like how I mentioned earlier. If your wedding band's tighter than it was, if you're having to use 2 pillows to sleep, if your pants are a little tighter, or if your socks are leaving rings around your ankles. Those can be very subtle signs that you're getting a little extra fluid on board, and you can let your doctor know.
I was not aware of that socks, being tied around the ankles could be
Mhm.
one of the symptoms because you've heard so much about just in general weight or your pants being tight.
Right.
The socks being an indicator is also a good thing. I think that's something that I'll be sharing from now on.
Yes.
Yes, definitely. And now, since you've worked with countless of patients over the last 15 years, and once they go home after the discharge, what are the biggest mistakes or major mistakes patients have made after going home, despite all those guidelines and reminders?
So I think a lot of times when patients go home, the mistakes that bring them back to us pretty quickly, and the ones that I see most often are within about 2 weeks of that hospital discharge. Number one, make sure you see your doctor, your heart failure doctor, within a week of discharge, just to make sure everything is okay. 9 times out of 10, we end up changing your medicines around, even if just for a short time while you're in the hospital with heart failure. It is so important to take the and to not skip doses. Or if we add, 3 extra, I know it can be scary to be on so many medicines. I know it can be expensive to be on so many medicines, but try your best. If you can't get your medicines, be honest with us. That we may be able to help you, in a way to get those. But just try your best. Get to those doctor's appointments. Take your medicines the way that you're supposed to, and weigh yourself every single day, and write it down and take it to your doctor.
Being yourself every day and writing it down.
Mhm.
You have mentioned about the salt intake. What is your take on salt and fluids when it comes to heart method?
So I think personally, and this is, my Jessica nurse belief, to me, salt is worse than fluid because where salt goes, fluid follows and it hangs around. So for me, monitoring how much salt intake you have is going to do more to help you stay out of the hospital and manage your heart failure than your fluid intake. With your fluid intake, They say, 2,000 milliliters a day. So that should be all that you have of any kind of fluid. So that also includes if you have jello, soup, or ice cream, anything that is a liquid at room temperature, that's going to count as your fluid intake. So I do have patients that, in the summer, they're outside, they're active, they sweat a lot. So I tell patients instead of focusing so much on that 2,000 milliliters, drink to your thirst. If you're sweating more, you are going to need a more fluid intake, and you may be able to wiggle around, that 2,000 milliliters. But if you drink extra fluid and you have a bologna sandwich, it's not going to work out because of the fluid intake, or I'm sorry, the salt content of the bologna. So you really just want to monitor that sodium because that's going to make you hang on to fluids. And then I say drink, to your thirst. So if you're thirsty, it's okay to have a sip. Don't chug, a two liter drink. If you're thirsty, sips are better than amounts at a whole time, if that makes sense. So instead of drinking a whole can drink, maybe sip on it so it lasts long. But the salt intake is definitely, I think, where a lot of people run into problems.
When I think of fluid intake, I would just think about the general like water or any liquids, but I don't think about the ice creams or anything that
Right.
can
Or
be.
even like melon. So watermelon has a lot of water in it.
All right.
So you don't think about that being a fluid,
Mm,
but it is.
right. Or cucumber.
Yes, yeah, very true. So
Right.
just, anything that has, a liquidy juice in it, that's going to count in your fluid intake. And while it may not be a lot, if you do it every single day, it can add up a lot quicker than you think.
Yeah, it compounds after that, right? Thank you. Learning very helpful tips and new stuffs today. They- and so I've also heard people, avoid exercises if you're a heart failure patient. What is the truth exactly? Let's bust that myth.
So exercise is always good, and I always encourage patients to do what you can. For some patients, depending upon the class and stage of heart failure, that might be, walking to the bathroom and back. That might be it before they're short of breath. For other patients, it may be to the mailbox and back. For other patients, they may walk 3 miles a day. So what I tell patients is, movement is great for multiple things. It works your heart, so hopefully we get some of that heart function, heart strength. Number 2, it helps to circulate fluid. So hopefully we can get rid of some of that fluid. It's not going to build up in the body. And I tell patients, do what you feel comfortable doing. If you get short of breath or you were to have chest pain, stop. But do what you feel comfortable doing that's easy for you, where you're not short of breath or experiencing chest discomfort.
Listening to your body.
Right. And that's so important for, I mean, for every patient, but for heart failure specifically. Unfortunately, after you've, been through the circus of the ER, the hospital a few times, try your best, listen to your body, sort of take in like, this is what my body felt like. And then I ended up in the hospital. Or this is what my body felt like. And I had to get IV Lasix. And try to track that so that when you're heading toward, in the wrong direction toward a hospitalization.
You've already mentioned one of the first things to not miss in the first week is visiting your doctor. What are the other things that patients should not absolutely miss after being discharged?
Right. So we talked about, fluid intake and those daily weights. So I would say be careful that first week, especially about fluids and salts, because your body just came out of an exacerbation. Sometimes it doesn't take much to send you back over the edge again. Like you're kind of getting used to this new fluid balance or your dry weight, as we call it. So just be very careful about what you eat and drink. Um, it's more important, I would say, when you're in an exacerbation or coming, just to be sure your diet is where it should be.
So, we're in the age of AI, remote monitoring. Remote monitoring has like completely taken over even cardiac failure heart
Mhm.
management as well. We've heard a lot about Cadence. What is your take on it? And do you think is it really helpful in terms of cardiac management?
So as far as the Cadence program goes, I'm a huge fan. I have, worked with Cadence since the very start of their program and sort of helped them map out how we're going to, treat these patients. How are we going to communicate with the hospital? And I can't say enough about how great of the work that they do. So one of the things that sets Cadence aside that I think works very well in their favor, most of these patients, they either pick up in the hospital before they go home. So they're monitoring them even before they leave the hospital with us. Or they get set up with their very first doctor's appointment after they leave the hospital. And the nice thing about Cadence is all of the monitoring that the patients do. So for a heart failure patient, you're going to get a scale, you're going to get a pulse ox, and a blood pressure. So every time you step on that scale and take a weight, there is somebody, like a physical person at Cadence, that monitors that. So if they see a weight gain that we're concerned about, they're going to call you. If they see a blood pressure change that is a concern, they're going to call you. Same thing, with your oxygen, your heart rate, all those things. There's somebody that monitors and they will call you. A lot of times, those numbers will indicate that you're about to have an exacerbation before you even feel it or before you know something is happening with your body. So it really enables us to be able to decrease hospital admissions, readmissions, and keep the patients at home. The wonderful thing about Cadence that I think really sets them apart from other home monitoring systems is they don't just have a person that can call you and say, "Hey, you gained 3 pounds last night. You should call your doctor." They employ nurse practitioners and they can do televisits with the patients, go over their signs and symptoms. They can adjust their meds, order labs, anything the patient needs over the phone in many cases. So it's kind of, you have an extra set of eyes on you at all times, if you want to look at it that way. And you have somebody that can really help change the course of, or the trajectory, I guess, of your heart failure and keep you at home while you do
Sounds like a wonderful program.
it.
A complementing the cardiologist or heart
Mhm.
doctor's coordinator.
Yes. And what's really nice on the hospital side, so with the Cadence coordinators that talk to the patients, let's say a patient, on Monday they had a weight gain, they got them into the office, they gave them some IV Lasix, they changed medicines, and it's still not working, and they have to come to the hospital. Those coordinators will call me and let me know. So I already know what we've tried at home. I already know where we are. So the communication and the teamwork, it carries over from home into the hospital seamlessly. So that has been a great help, especially when you get to the ER and we already know we've tried X, Y, and Z. So we don't have to do that again. We already know where we're at.
So yeah, like it's like a lot of moving parts involved, but it
Mhm.
helps each moving part stay on top of each other, helping when the overall care of the patient then.
Yeah.
That
And if the patient doesn't have any problems at home, they're not short of breath, their weights aren't changing, we're just in the background waiting. We don't do anything. So it's a little bit of comfort, I think, for patients and families to know that somebody's watching those numbers all the time. If you do need help, you can reach out or we'll reach out to you. But then you also are able to, keep your independence and be at home and do what you want to.
patient gets to stay in the comfort of their home and take care of themselves while the clinical team is doing their own work and side by side monitoring the patient as well. If every heart failure patient could take one action starting tomorrow, what would you tell them?
So I think the best action you can take physically is to weigh yourself every day. That is your biggest indicator that you're headed toward a problem. The second thing is to be an advocate for yourself and really be involved in your care. Like I say, heart failure is not, a cookie cutter, one size fits all for the patient. So really talk to your doctor about your options, about the different medications that are out there and how you feel. Because, we know the medicines to give you, but if they make you feel worse than what you did before, it may not be the right thing for you. So just speak up, be involved, and weigh yourself every day.
Absolutely. I think that's wonderful. Like you said, be your own advocate because a lot of time as a patient, we're a little unsure or, we are a little hesitant reaching out to the doctor. I think maybe I'm just feeling it. It might not be the medication. Maybe I'm just overthinking it. But it sounds like when it comes to heart failure, we just have to be very proactive when it comes to managing ourselves and our health and just reach out to the provider as soon as we can.
Yes. And I think too, don't be afraid to, if you're like me, I'm a nurse, but still, when I go to the doctor's office, I always feel like, "Oh, I forgot to say that," or, "Oh, I wish I had, brought this up." So don't be afraid to write things down while you're at home that you wanna make sure that you mention, or don't be afraid to take, your spouse, your friend, whoever with you, just to make sure that you understand everything, that you heard everything right, and you really got all of your questions.
Yeah, I think that's another wonderful tip too, because sometimes the patients will be feeling like I'm in the pink of health. I remember everything. I think I can go on my own. Or sometimes you have
Mhm,
this tendency. I do not want to bother my even your spouse. I do not want to bother my
mhm.
But in cases like this, I think it's best to have someone. So you have two sets of ears also
Mhm.
listening to the provider,
Right.
right?
Yes.
Thank you so much, Jessica. This was wonderful. And that was a lot of information to unpack for our listeners as well. Thank you so much for being here.
Thank you very much for having me, and I have enjoyed it.
Thank you.